So I stand Lady Gaga's views on mental health, but her opinion on chronic illness, that's an issue. Hey guys, welcome back to my channel. How are you doing today? I hope you're having a great day so far. So ignore the cat in the background, the light, it's daytime. I'm actually recording during the day and my cat Midnight decided she just wants to sit right there and beam some light in. I'm back because I wanted to dig a little bit deeper in Lady Gaga's interview with Oprah because there was a stance that she had that I did not like, I did not appreciate, and it was about chronic illness and mental health. Now in a previous video that I did on The Rewired Soul and how he did not like Lady Gaga's taking psychiatric medications, and also his stance on her stating to go to a psychiatrist and not your primary care physician. Now, if you didn't check out that video, I will go ahead and link it up here for you guys to go have a little gander really quickly. But during that video, I had shared that I did not like her stance on pain medication and chronic illness, and that's what we're going to talk about today. But before we even get into all of that, if you are new here, welcome. This is Journey to Find Kay, and I'm Kay. I like to talk about mental health. I usually react to The Rewired Soul, but I also choose other topics here on YouTube if I feel we can learn a lesson about mental health and or substance abuse and recovery, because I'm a mental health patient, worker, and advocate, and I want to use my opinion and my experience to negate some of the negative things that get put out on this platform. So if you enjoy my content, you enjoy watching me, don't be afraid to hit that subscribe button down below, hit the bell so that way you're also notified every time I post a video. So first off, you guys, I have an announcement, and it was something that I toyed with for a second. I didn't know if I was going to do it, but then I said, you know what, let me just do it. So I went ahead and started a Patreon. I did, you guys. I started a Patreon, and I'm gonna let you guys know I have a special going on right now. If you go head over to patreon.com/journeytofindkay. Time you see this video, I have a special that went live to where you will get a personalized shout out. I will shout you out by name on my next YouTube upload for just going over there and signing up and showing your support. I definitely want you guys to go over there and check it out, see my different tiers. I start my first tier at $2. Wanted to make it affordable for some people, and some people just want to support and don't give a flying crap about anything extra or any extra perks. So I wanted you guys to know that I started a Patreon. That's where you're going to get an unfiltered Kay. I just recorded my first video for Patreon, which will be up on Friday, as well as this video. And let's just say I kind of cursed a lot. We know YouTube doesn't like that over here, so I definitely encourage you guys, if you want to go ahead, head over to Patreon, because that is just another way you guys can support me and this platform here on YouTube and over there. It doesn't matter to me. I honestly just love the fact that you guys are here supporting me on YouTube, commenting. You join Patreon, it's cool. I don't care. I just love the fact that you guys are here watching me and you enjoy my content. Get such great feedback, negative or positive, criticized or not. I love it because you know what? That shows that I am cultivating a community where we can have adult conversations, open minds, and think critically. So I wanted to announce that with you guys. So don't be afraid to run over there, check out my Patreon. It's a little bit bare. It is, because I just started it. And that's where you guys will see me unadulterated, unfiltered, cursing, not so professional.
You know, I'm not that professional over here either, but I mean a lot more not professional.
So don't be afraid to go over there and check it out. So yeah, you guys, I wanted to come back and just have a little bit of a deeper conversation about this whole interview with Lady Gaga and Oprah, and just the one part that I really had an issue with. The reason why it's been hanging on my mind is because there are two great YouTubers that I support and love, and that's Straight Talking Fedora Chick and Lisa Duncan. They had a live stream sharing the misconceptions that people have about people with chronic illness.
So anyways, like I said, we're going to be talking about chronic illness, but more specifically societal misconceptions.
You know, and I've said this before on my channel, you can have the absolute best mental health, okay? You get diagnosed with a chronic illness, especially one that causes pain, one that is debilitating, one to where it limits you physically. It will affect you not only physically, it will affect you mentally, and it will affect you emotionally.
Okay, you get the idea. A city where they think anorexia is a healthy lifestyle. Oh, no, this is true. They are hostile to overweight women here.
Oh, wow. Well,
But-
they want you to lose weight, yet most of the medications that they put us on cause weight gain.
Yeah, I know. SSRIs, steroids like prednisone.
Another good point, and it's also one of my biggest pet peeves. She said, I don't like it when we try to be open to people only for them to judge us and give us suggestions.
Oh God.
Y'all, I hate that.
God.
If your essential oils and eating a certain way would fix my brain,
Yeah, we'd be doing it.
exactly. And that drives me. Oh my God, it drives me insane.
And so listening to them share and the things that I experience every day with my clients, most of my clients have chronic illnesses and are taking care of their mental health. There was a statement that Lady Gaga said talking about the fact that she doesn't like pain medications for chronic illness, things like that. If you take care of your mental health, then that can help you with your chronic illness. Now, I'm not negating everything that she said, but the way that she worded it and the way that she framed it, she made it come across that if you have a chronic illness, she made it seem like that all you really need to do is go see your psychiatrist, engage in therapy, take the medications that are prescribed if they give them to you, and you'll feel better. And
So what's the things that you do on a regular basis to keep yourself whole? Medication. So you're medicated all the time?
Yes, every day.
Every day?
What
You're
these
not,
medicines are.
you're not on pain medication?
I take no narcotics at all. No pain no.
Yeah.
If I call my doctor and I'm in a lot of pain, and I say, I need something to take this pain away. It's just too much. It's been 11 days. It's been 11 days. He says, well, you can go to the hospital and you can ask them to give you pain medication, and then I'm going to tell them no. And it's what they're going to give you is already in your purse. So just go to your purse and take your medication and be in pain in the privacy of your own home. And he doesn't mean it to be not nice to me. It's just that this is how we keep me safe. And this is how I want to keep the world safe as well. I don't want people in pain taking pain medication. This is not the way that this is going to work. People will become addicted, and there is a correlation between mental health and chronic pain, and mental health is the biggest crisis in the world, right? So what's happening is while mental health is the biggest health crisis that we have, right? There's also chronic neuropathic pain being produced by this. And that helped me the most was a drug called modafinil. I don't know if anyone knows that drug, but it's in the morning when I wake up, I'm in tremendous pain most of the time, and it just kind of turns the lights on, and my brain just kind of wakes up, and then before I know it, the pain starts to dissipate a little bit.
So,
but no narcotics.
No narcotics.
No pain pills.
No pain pills.
No Xanax.
Not even a Xanax.
Not even a Xanax. I was like, that's how I'm gonna heal. It's just by accepting that I'm gonna feel awful all the time. I'm gonna be in head to toe pain constantly. And he said, you have to radically accept it. And guess what? It took a little while, but I did. And you know what else happened after that?
What?
Slowly, the pain dissipated, slower and slower and slower.
And that is not the case. And that is a very damaging statement to put out there in front of so many people. Because again, it's Lady Gaga, it was Oprah, it's Oprah's Weight Watchers convention where it was a stadium filled with people. And then you have people like me watching on YouTube who might not understand and might walk away taking from that conversation that, oh, all I need to do is go see my psychiatrist, see my therapist, start my meds, and I'll be good. My fibromyalgia will feel better. My diabetes will be better. My hidradenitis suppurativa, my lupus, my whatever chronic illness that you might be living with, it will just instantly get better because you're taking care of your mental health. And that's not the case. That is not the case. And that is why I wanted to talk about this, because I've seen too many people, I've witnessed just from that stream, too many people sharing their experiences about how people judge them because they have a chronic illness. And it might be a chronic illness they can't see. It might be one that they see. Whatever the case is, doctors and people alike judge people with chronic illness. And we cannot sit here and allow someone with such a following as Lady Gaga these type of statements without calling her out. Yes, she ain't gonna ever hear from me, but this is something that I feel like I need to use my platform and share that no, that's not the end all be all for your chronic illness. That's not the only thing you need to do to take care of your chronic illness for it to get better, to live a better quality of life. And that bothered me. So one of the things that is really big out here in Arizona that was pushed since 2014 officially is integrated health. So when we talk about integrated integrated health, we're talking about making sure people are taking care of not only their physical health, but also their mental health and how they coincide with each other. I consistently have to educate my clients and sometimes doctors on my role in the reason why me from a mental health clinic is going to a doctor's appointment, because it's slowly becoming an understand thing that your mental health affects your physical health and vice versa. We now want to make sure that you're not only coming to see us for your psychiatric medications, but you're also going to see your doctors, your PCPs, your specialists to take care of any other illnesses that you might have. And I had a client who was living with lupus and other chronic illnesses, and she would come to us to take care of her psychiatric medications and therapy. And she worked with me because when it came to her physical health, she needed assistance in making sure she kept those appointments and making sure that they were coinciding with us, talking about medications we're providing, the medications they're getting, helping her advocate at those doctors instead of them thinking,
oh, it was just her mental health.
and even when she was hospitalized, making sure that she was getting her psychiatric medications while she's there. Why? Because they all tie together. When she was having a really bad bout with her lupus, she would be depressed more. And I remember a conversation that we had where she was like, hey, Kay, is it possible that my illness is affecting my depression? And I said, yes. Yes, it is. That's what happens. That is why we are so big on integrated health. Because if you feel like crap, it could affect your mental health where it could cause you to go deeper into a depression or maybe even trigger a depressive episode, depending on your diagnosis and of course, depending on the person. If you're not taking care of the chronic illnesses that you have, yes, it does affect your mental health and vice versa. But the issue with Lady Gaga, the issue I have is for her to understand that you taking care of your mental health, you coming to see your psychiatrist and speaking with your therapist and learning coping skills isn't going to automatically cure all of these chronic illnesses. It's not going to automatically cure people with fibromyalgia. And the reason why I say that is because she kept using it as an example as a diagnosis that she has. And that bothered me even more because I've seen it where people do not take fibromyalgia seriously. I've sat here and I've watched clients get judged because the doctors don't believe what they say when they're talking about fibromyalgia. I've had clients be in pain because their doctor didn't want to prescribe them Lyrica to assist with their fibromyalgia. So for you to sit here, for Lady Gaga to sit here and say, go see your psychiatrist, see a therapist, that'll help your chronic illness. I don't think we need pain meds. Girl, what? And let's not even get into the ones who have cancer, who are literally living with pain every day, who can't afford surgeries, who can't afford the best doctors. I work with low-income clients. These people are on state insurance, and I just had to get off of a phone call that lasted 30 minutes with someone's insurance trying to find a way for them to not pay bill for the claims that these people are putting for just their mental health. Can you imagine how they do with their medical? I've had to deal with that as well. Speak with their health plans to make sure that these people are getting the services that they need. So sitting here telling people that if you just take care of your mental health, that's what's going to help. It helps, but it's not going to cure. So sitting here telling people, if you just go take care of your mental health, if you go see a psychiatrist, you get on these medications, you see your therapist, you work through these things, you won't need pain meds. You know better, Lady Gaga. That is a point where I can say, okay, that's where she might not be so connected to the regular population, because that's not something you're going to sit here and tell people who have cancer, tell people who are living with illnesses that can cause pain. You're not going to sit there and tell them to just go see a psychiatrist. You don't need pain medications. You don't need to take all of these meds to feel better. Your mental health will make you feel better. Like, no. Does it help? Yes, it does all the way. And that's my role in this field, is making sure you're taking care of all of it, because we've understood that if you are not taking care of your physical health, your mental health will slide, and vice versa. We all know if you're depressed, a lot of times your body feels lethargic. You might feel like you're coming down with an illness. I know when I'm in my depressive episodes, I don't want to get out of bed. I feel like I'm sick. Like I'm literally sick. So I don't like that she sat here and with such a big following that she has, stated that if you do this, this is what's going to help your chronic illness. You don't need pain medication. I understand the epidemic, the opioid crisis that we have, but there are plenty of people who legitimately need pain medications, and there are legal routes to do it. I assist my clients in getting pain management specialists. They go there. I speak with them. They interact with us. They talk to their PCP. They are the ones who are only able to prescribe those medications. My clients have to do drug tests to make sure their levels are right, that they're not selling them. They're not doing this. It's serious. And the people who do these things are people who legitimately need it. Like, I get the crisis, but it's not just everyone out here trying to get it just to get it. There are plenty of people out here who truly need it. That's where it sucks in society, where yes, bad apples kind of mess it up for everybody else. But we should not be sitting here telling people that, oh, because we have a crisis, you don't need pain management. You don't need pain meds, because you don't know these people and you don't know their quality of life. And I'm all about everyone having a great quality of life. So that was an issue that I had. If you need pain meds, do the proper route. Speak with your primary care physician. I know out here in Arizona, we have passed laws to where your primary care physician can only prescribe you at most 7 days of opioids, and then you get a referral to a pain management specialist because they have the authority out here to change those medications. And if you get it somewhere else, they kick you out of the program, and that follows you to your next program. Like, we're serious because we were hit pretty hard out here with the opioid crisis. So go with the proper routes. Go to your PCP, because again, it's state by state. See what they're able to do for you. If you need to go to pain management, go to pain management, and don't feel bad about it. Take care of your mental health. Go see your psychiatrist. Take your psychiatric medications if you're on them regularly, consistently, by doctor's order. And yes, that will help your chronic illness. Yes, that will help any pain that you might have, but it's not going to take it away, and that's not for everybody. But it is important that you take care of both of them at the same time. And that was my issue with Lady Gaga. She had a great stance. She did great in what she was saying overall with mental health, but that part about chronic illness and pain and not needing it and just taking care of your mental health, that was straight trash. Because again, it pushes that stigma that it's all in your head, that you're lazy. If you took care of this, then this would be better. It's pushing the stigma that so many people with chronic illness have to deal with every day, by doctors, by their loved ones, by people they don't even know. And I don't appreciate that, and I don't like that. So I wanted to share my experience with you guys. I want to hear from you guys down below. Do you suffer from a chronic illness? Have you felt that judgment from doctors that it might be all in your head or there's nothing really wrong with you? Did you see the interview with Lady Gaga, and how did you take her stating that going to take care of your mental health will fix the pain and fix your chronic illness and you won't need pain pills anymore? Are you as upset as I am, or am I a little bit more upset than you are? I want to hear from you guys down below. Again, don't be afraid to check out my Patreon to support if you want to. There's no pressure. The link is going to be in the description down below. Don't be afraid to check out Straight Talking Fedora Chicks and Lisa Duncan's live stream. I'm going to link both their channels as well down below for you guys. Also, don't forget to check me out on Twitter at JourneyToFindK, Instagram at JourneyToFindK, and I will be back with another video for you guys in a few days. I appreciate you guys so much. I will catch you guys later. Bye.